Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending about 50 minutes or so discussing the relationships that we have with key carriers and markets, but specifically today, working with Humana because they are such a national presence with strong benefits and great support. We've asked for help with some other folks to come on and visit with us. So Gabe Moore is our featured speaker today, and we'll get through some things really quickly. I want to, however, take care of some housekeeping up front. Today's presentation is being recorded and will be available on our webinar, on our website at premiersmi.com and on our YouTube channel, and will be available through your agent marketer, your agent success manager with Premier as well. You'll notice in the software package that there's a section for both questions and chat. We ask that you put your questions in the questions box. We find that normally we cover most questions through the course of the presentation, but we're going to make certain that we address any inquiries that you have to make certain that you get full value out of today's presentation. And since this presentation is aimed at people with different levels of experience, you're going to find some things that are going, gee, John, I know about Premier, or I know about these lead programs, or I'm pretty familiar with Humana. There may be things, however, for some folks that aren't, and for others that might be a very welcome review. And so with that in mind, let's start with a little bit of level set about who Premier is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states, acting as an insurance wholesaler, working through independent insurance agents such as yourself. And we do so through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full portfolio of products aimed at our target demographic, and that includes the base medical programs for Medicare, the Medicare Advantage and Medicare Supplement plans, and the standalone prescription drug plans. But we also offer a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, and also long and short-term care programs, disability income plans, and ancillary benefits that address those specific needs of a good portion of the population with whom we visit. You look at Medicare Advantage, it's got the national carriers in there for you, many of the strong regionals there for you as well. And that's one of the reasons why we want to make certain we invite key partners to visit with us about the opportunities they have, hence our presentation today with Humana. That same philosophy carries over into the prescription drug programs, those standalone PDP plans, where these are normally a part of the contract that you get on the MA plans, but there's a couple notable exceptions. Mutual of Omaha is a separate addendum than any other part of their offerings, and Clever RX is actually a discount program and not a standalone Part D plan. When we look at Medicare supplement programs, there's a vast array of choices there for you as well. And it includes access to different marketing programs and technical support that can help you be successful in this space as well. Ancillary products, each of the categories, national leaders there for you. And this gives us an opportunity to add another means with which to market. It also gives us the opportunity, most importantly, to address the specific needs of our prospects and clients. But of course, it also creates an additional revenue stream for ourselves and our agencies. When we look at the Medicare market, we hear the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. And if you look at things based just on age, wow, it's a near exponential growth. But what we've seen and what different pieces of information have clarified for us is there are a number of folks that are working past age 65, or for one reason or another, just not accessing all of their Medicare benefits when they're first eligible. Some of us that are at the tail end of the baby boomers, in order to get full Social Security, we got to work till 67. That might be a factor. It might be the effect of the pandemic on different retirement plans. Hey, it might simply be due to the fact people are healthier, they want to continue to working. They like to work. Whatever it is, it tempers that number a bit, but that's more than made up for by the folks that are under the age of 65 and accessing care because of disability. The programs that we discussed today are perfect opportunities to address the needs of this population as well. And it's, look at that, that's a lot of people on Medicare. So we have a grand opportunity. And even though we have entered into the lock-in period, we have opportunities to help people year-round because we're able to adjust and offer programs that help people, whatever their choice may be. Because let's face it, people coming on Medicare, they don't have to do anything. They can defer Part B if they want to, and some folks, it's the proper move if they're continuing to work and they've got other coverage. However, some folks will look at that and they'll go, oh boy, with Medicare, I'm going to self-insure for what Medicare doesn't cover. I'll pick up a standalone Part D plan to help me with my medications. Some folks will add a traditional modernized Medicare supplement program to help with that financial shortfall, so to speak, when it comes to coverages, and pick up that prescription drug plan. And then others will go into the bundled programs we hear so much about on television in the Medicare Advantage plans, the Part C programs, where the coverages are most commonly rolled into a singular package. I mentioned before that we're already in lock-in, so why are we addressing this now? Well, a bunch of the folks during that open enrollment period didn't do anything with their coverage. They didn't review it, and 7 out of 10 of them didn't. And so they are a grand opportunity for us to reach out, because at this point in time, they're probably accessing care for medical purposes or picking up prescriptions, and then all of a sudden they're aware of the fact that their coverage has changed. So they will be looking for help in detailing other programs, and it gives us then that opportunity to make certain, regardless of their base coverages, that we're there with programs that can help them, and we can help explain it because we have an acronym guide that helps with, in this particular circumstance, this screenshot from CMS's website, 4,420 acronyms. We want to make certain that we communicate properly with the folks that we visit with. And that's not just to remain compliant. It's more importantly to make certain they understand what they have and what's available and what course they may want to take in the future. They're not using the detail that's given to them by the government. They're not reading through their Medicare and U book. They're not using electronic applications for the most part to do this. And heck, not even accessing some of the wonderful pieces CMS actually puts out on the internet that explains different coverages. So we, with technology, can deliver upon information that people will recognize, read, and absorb, hopefully. And we do so through different programs that we have that enable us to deliver that information in the manner in which our prospect wants to receive it. So, are we going to sit across the kitchen table, shake hands, kiss babies? In many cases, yes. Are we going to do things virtually through a Zoom call or whatever that circumstance may be? In many cases, yes. And it may be also a bit of a hybrid situation where we're combining those two means of disseminating information. We're doing so because the population we address is becoming increasingly digitally savvy. If we think about it, that first year in the pandemic, most of our doctor's visits, hey, they were done virtually. Be it primary care or specialist. You saw a lot of the prep work done for hospitals or with dentists done virtually as well. And other parts of our lives, the way we practice our faith, a lot of that was done and continues to be completed virtually as well. So we have a population that's willing to receive this information in the fashion that's most expedient for everyone involved. And we want to make certain that we are working with partners that help us with systems that can deliver that. I mentioned we are in lock-in. Well, the standard election periods obviously do apply, but we have the special election periods that we see year over year, even the special election periods that are available based on different circumstances. We look at some of those opportunities for the Medicare population and we see, hey, the majority of people probably qualify for one of these or another. It's a question of, is that in their best interest? Hence, the certifications we do, the familiarizing ourselves with the different plans that are available in our target markets, and partnering with key carriers that can help us deliver those programs that are best suited for the individual. So that brings us to the big point of, let's shut up, John, and let's ask Gabe Moore to come on and visit with us about Humana and the opportunities it brings to us. So Gabe, I am turning control over to you.
Thanks, John. Appreciate you having me. Can you see my screen?
Yes, sir.
All right. We are in some exciting times, everyone. The Medicare space, I've been with Humana since 2007, and probably shortly thereafter, I realized that the Medicare space is probably the best kept secret in insurance. Back then, you didn't have near as many agents today representing Medicare Advantage plans. And so the secret is out of the bag. Lots of opportunity out there in the Medicare space. And today we're going to go over why you definitely need Humana in your back pocket. Just learned yesterday that CMS came out with some data that Humana actually had 54% of the industry growth during AEP. We led all carriers, and part of that reason is because of all of you. We've got a little over 70% of our sales come from our partner channel. We certainly appreciate all of your engagement, and certainly want to make sure that we can help you continue to grow your book of business. This is your partner channel management team for DFW, East Texas, and Arkansas areas. So this is our direct contact information. Please feel free to take a screenshot of that if you'd like. Call us anytime. Call, text, smoke screen. That's what we're here for. Again, my name is Gabe Moore. I'm the broker relationship manager for Humana here in the Dallas-Fort Worth Metroplex. We're going to talk, kind of keep it short. I'm not really big fan on death by PowerPoint, but the reason why I do PowerPoints is because it keeps me on track. I tend to get off on a ledge every once in a while, off on a branch every once in a while, and can go kind of long because this is a fun space to be in. So why Humana? So a couple of things that Humana does. We definitely make healthcare more human for our beneficiaries, and we've gone a long way in doing so. This last year, Humana created $1 billion in their budget, year-over-year budget, to invest more into our members, so we can be best in class, not only for our members, but for all of you out there as well. So we want to make sure we've got the right products, the right plans, and the right benefits built into those products to suit our members where they need to be met. So again, we are driven by a passion for human care. As you can see here, there's a circular arrow that says trust, health engagement, and outcomes. So we want to make sure we are, those three things are working synonymously together. We've got the Humana Bold Goal, which is in several markets across our country. And that bold goal, we actually exceeded. We wanted to increase the health, or I guess better the health of 20% of the population by the year 2020. We exceeded that. I believe we went to a little over 40% of the population was considered healthier than when we started. So in a lot of those markets, we were able to accomplish that. So we are, Humana is a very military-friendly company. If you're not familiar with our honor plans, or maybe USAA endorses us. We've got several exclusive relationships with our military organizations across the country, such as the VFW Halls, American Legion, and Disabled American Vets. And so lots of engagement out there on the military side as well. So a few things about Humana's Medicare Advantage value proposition. We're ranked number one in customer service among health insurance companies, as ranked by Newsweek. 97% of Humana members in 4-star plans and above. That's more than any other carrier in the country. 98% of concurrent members saw benefit stability or improvement in 2023. 27% fewer hospitalizations compared to original Medicare. 8.4 million Humana members in all 50 states, including Washington, D.C. and Puerto Rico. $3.5 billion saved by Humana members on medical expenses as compared to those who have original Medicare. Those are some pretty staggering numbers when you think about it, right? And it's, again, exciting to be in this space. I'm going to go through every number on this screen, but we did expand our footprint into several counties across the country. As you see there, our HMO at the top, we expanded into 259 more counties across the country with HMOs, LPPOs, 200, same number, and fee-for-service plans, 110. So we continue to expand in all counties. Humana is actually in every county in the state of Texas. think last I saw, what is it? The number of counties in the state of Texas, over 250, 260. I should know that, but we're in every county in the state of Texas and very competitive here. So we've got some additional benefits we added, which I'm going to show you here. I pulled our lead products for this year. We've got some benefits that I've never seen on plans before. That's what's made it so exciting to write Humana this year and to offer your clients, such as the SSBCI benefit and the value-based individual dental benefit. So we're going to take a look at those here in a second. We continue to grow. This has not been updated to reflect 2022. The final numbers probably just posted. But as you can see there, due to your dedication to Humana and our relationships, we have continued to grow every year since 2010. Most recent data in 2021 is 73% of that growth came from our partner channel. Some lead products in Dallas-Fort Worth. So we've got products all throughout the state of Texas. If you sell outside of the DFW area, the DFW Metroplex, please feel free to reach out to me. I can certainly walk you through maybe your broker manager in your area or the plans that are offered in that area. But we do have some very competitive HMOs. This is our newest HMO this year. We had a hard time keeping this particular plan on the shelf. This plan blew it out of the water for us. Agents loved it. It's got a $25 a month premium, but as with any Medicare Advantage plan or prescription drug plan that has a premium, it's reduced based on their LIS level, right? So if someone is 100% Part D LIS, they would pay nothing for this plan. If they're at 50% Part D LIS, they would pay $12.50 and so on, right? So, but check out the benefits. Even if someone wanted to pay $25 a month, maybe they don't have Part D LIS, the benefits are unbelievable. $0 for PCP, $15 for a specialist, very low max out of pocket at $34.50, $200 a day for the first 5 days in the hospital, and a $5,000 dental benefit. Now, with every one of our plans this year, beneficiaries, our members, have $1 coverage, and it's a true benefit on their dental. So they pay nothing, zero, nada, for all covered benefits on the plan. So root canals, crowns, dentures, and so on, fillings, they pay nothing for that first, in this case, $5,000 worth of dental. Advanced level hearing aids are $0. Those hearing aids are $2,400 each. Those premium level hearing aids at retail cost are $3,200 each. So they're getting a significant discount on those hearing aids there. They're Bluetooth enabled. $150 quarterly Visa OTC retail card. So every quarter they get $150 loaded on the Visa debit card to go use at various retailers across the country. $400 towards vision. And the bonus on this plan is a $1,000 annual flex debit card. It can be used towards any dental, vision, or hearing covered benefit. So you're probably scratching your head and saying, wait a minute, Gabe, why would they use it for dental? Well, they don't need it for the first $5,000, right? Because everything's covered 100%. But let's just say, for example, if they needed, I'll say everything's covered 100%. All the covered benefits are 100%. But if they needed, say, $6,000 worth of dental, or $5,500 worth of dental, or maybe there's a procedure that isn't covered, they can use that $1,000 flex card towards dental work. Or maybe they want those premium level hearing aids at $299 each. They can use a $1,000 debit card to buy those hearing aids. So very, very nice feature there. Unlimited transportation, insulin savings program, silver sneakers. There's no prescription drug deductible. There's no deductible on this plan whatsoever. Tier 1 and Tier 2 copays you see there at 0 and 5, and it does include Philips Lifeline, which is the emergency alert system. You know, the fallen, I can't get up system. It's installed free at their house at no cost to them. As you can see there, the service areas down below. You got to live in one of those counties in order to get this thing. And then our regular traditional HMO, this one costs you nothing. So regardless of Part D LIS status, you pay nothing for this plan. Bringing it back this year, it's doing very well. We lowered the max out of pocket, you see there, to $3,400. Hospitalization was lowered as well at $250. $3,000 dental benefit was increased from $2,000 last year, and Again, $0 coinsurance and copays for all covered benefits. $100 quarterly Visa OTC retail card. Transportation is built in it as well. So we added transportation and also enhanced that OTC benefit this year. $0 deductible for prescriptions, and your tier 1 and tier 2 is $0 retail copays. Insulin savings program, $200 towards vision, silver sneakers, and again, Philips Lifeline is a part of this plan as well. The HMOs have done a very nice job this year with satisfying thousands and thousands of members out there. So we got a nice D-SNP plan. So those of you that sell to the Medicaid, the dual eligible population, this particular plan, you notice I've got the last 3 digits highlighted. Make sure you write the 032 plan, not the 031. If you have questions, please feel free to call me as to why. But this plan has a $4,000 dental. Again, all covered benefits at 100%. Transportation built in. And this has a $75 monthly prepaid card, so they can use it towards purchase of food, home supplies, over-the-counter products. It can also be used for non-medical transportation, general supports for living, such as rent assistance, internet and utilities, social needs, aging support, and assistive devices, pest control, and pet care and supply. That's a mouthful, right? $0 retail copays for all tiers, and then $250 towards vision. And $0 hearing aids. Those advanced level hearing aids cost you nothing. Our clients that have this particular plan have access to our entire HMO network, regardless if that provider accepts Medicaid or not. So it's a nice feature there for folks that have just Medicare and Medicaid. They can only go see providers that accept what? Just Medicare and Medicaid, right? Well, if they join Humana, they have access to our entire HMO network, which opens up a lot of provider doors out there for them. We've got several different LPPOs. This is our lead LPPO for DFW. As you see there, the service area on the left. This is a new plan this year. It's a $0 PPO. It's offered in those select counties on the left-hand side. Nice max out of pocket, very competitive copays. Our PPOs are built on one national network. So regardless of what PPO someone has, if it's a Humana PPO, they have access to the same doctors nationally. So if they want to go get a second opinion from a doctor in another state, they can certainly do that. If they're in network, they're going to pay the in-network copay. Out of network, they'll pay the out-of-network copay due. So just know it's one national network. So it's not this was our lead PPO for this last year. So $75 quarterly Visa OTC card, insulin savings program, Philips Lifeline, and so on. We've got honor plans. So that was our lead PPO for this year. MAPD PPO, I'd probably say, did the best, but we've got other PPOs to look at. We've got an MA-only PPO. This one is marketed heavily to veterans because veterans typically have qualified for VA coverage, or a good number of them have qualified for VA coverage, which is credible prescription drug coverage, right? So they just need that coverage or that protection outside of the VA if something were to happen to them, right? So rather than just original Medicare, they've got nice expected copays and low out of pocket just in case something happens. This plan pays $50 with a Part B premium. It's got a $5,400 max out of pocket and all the rest of the benefits down below. If you haven't taken that, now this plan is offered in over 100 counties in the state of Texas. So you'll see this plan all over Texas. And if you haven't taken our Veterans Healthcare and Medicare training, strongly encourage you to do so. We take a nice deep dive into how to engage with veterans who have Medicare and or one of the 3 coverages, which is VA, TRICARE for Life, or CHAMP VA. So we educate agents on how to have good conversations with clients who have any of those coverages in addition to their Medicare. So I encourage you to look out for one of those trainings. All right, we got another MA-only PPO. If you notice here, though, it pays more of the Part B premium. So instead of $50 for the Part B premium, it's $125. But where there's give, there's take, right? So you notice the max out of pocket's a little higher. Copays are a little higher. Not as much dental, right? So this one does have the Visa OTC card. So, it's give and take. If they want to save $125 a month on their Part B and the max out of pocket isn't something that matters to them, this is a nice plan for them to look at. Some go-to resources. Now, we do have other give back plans. We've got 2 other MAPD PPO give back plans, not MA only. So we have 2 MA only PPOs that are give backs and 2 MAPDs that are give back. For the sake of time, and want to respect everyone's time this morning and the amount of information you're listening to today, I've kept it down to our lead products in 3 different kind of sections there. Some go-to resources. We've got My Humana Business Center. Guys, this is an awesome, awesome tool located in Vantage. You can break down your book of business. You can take a look at what plans your clients have. You can even look and see if you've got clients that have Part D LIS, or if you've got clients that have Medicaid, right? Sometimes you've got clients that have Part D LIS and don't even know it. If they have Part D LIS, you can certainly give them a call, any time of year, as long as they haven't made a change. They have an SEP once per quarter to make a change, and so that $25 HMO suits them nicely, right? It's worth definitely having that conversation. We've got text signature options now with eHub. So if you would like, or it's very convenient for you, we've got several different signature options in eHub. And the most latest added is the text signature. So you can send a text for a signature on an SOA or an application, So makes it super easy to do business with us there. And we also have the ability to digitally sign and electronically sign, and of course telephonically sign as well. So lots of flexibility there for you. And of course, you get enrollment status notifications, so you can opt in to that if you'd like. So lots of capabilities in Vantage. So I encourage you to go in there and play around. Definitely, I don't know if you remember those old sandboxes we played in as kids, but those things are pretty much indestructible, right? So you can come in here and play around. There's a lot of different links you can check out, but we do have service inquiry, which is probably it's a feature that keeps you very efficient out there in the field. So think about if you've been in this space for a while. Think about how often you've been on the phone on a 3-way call with your client for 45 minutes trying to figure out something with the carrier, right? Maybe it's a claim issue or what have you, right? Well, no longer do you have to do that. So there's a tool in there called the service inquiry. You can submit an inquiry to claims, or you can submit a correction if you made a mistake on an application. You can change PCP. There's all kinds of capabilities in there you can do for your client that really helps keep you efficient out there. Again, this is outlining service inquiry, so definitely want to encourage you to take a look at that. You can do all kinds of different things, like I said, claims, benefits, billing, or general. Someone from Humana, say for example with claims, will reach out to your client within 24 to 48 hours and says, "Hey John, this is Gabe Moore with Humana Claims. Your agent Steve asked me to give you a call concerning XYZ," right? So really, really nice feature. Again, keeping you off the phone, off 3-way, and out there in the field selling. Find a Doctor tool. It's got so our Find a Doctor tool is a very nice feature. It does rate different providers based on clinical quality and cost efficiency. You can also filter out the type of provider you're looking for. So if you've got a client that, say, for example, speaks Chinese, and you're trying to find a PCP that speaks Chinese, you can do that. You can find providers that are virtual or do in-home visits. So lots of different filtering options there. That certainly is not limited to those as well. There's a lot of different options you can do. Other earning opportunities. So Humana Reach Rewards. If you haven't done this, if you are certified to write Humana and you haven't signed up for Humana Reach Rewards, well, I'm giving you a homework assignment. It takes you less than 5 minutes, and you're missing out on a lot of rewards, monetary. Especially, I know that probably perks some ears out there. So go to humanareachrewards.com, and it's going to take you less than 5 minutes to sign up. Make sure you click sign up. It's very tempting to enter your SAN number when you go there. Don't do that if you haven't signed up yet. They won't recognize you. But you can earn points throughout the year for a new Medicare Advantage sale. And if you see there, all those sales there on the left, or any agent engagement. We do host monthly trainings here locally, and even at the national level, right? So if you want to attend, say, one of our local or national veterans healthcare and Medicare trainings, for example, you would earn points for doing that, or downloading materials or ordering materials on, in our Marketing Resource Center. And this is how those points add up, right? So you've got bronze. Once you hit bronze, Humana automatically deposits $50 in your Marketing Resource Center. Silver is additional 100. If you do the math, you make it all the way to ambassador, you've had $1,000 loaded in your Marketing Resource Center, as well as all the extra benefits. You see here the AHIP reimbursement is right here at Platinum once you make Platinum. Premium agent customer service support. So not only do you have myself and Allie and all the other partner channel management team there for you, but you can, when you call agent support, you're routed to a different concierge zone. Member care assessment. If you haven't done this, this is your other homework assignment. Nice, easy way to earn an extra $60 per survey. So some carriers call it the health risk assessment. We call it the member care assessment. And you do have to make sure you finish the training in Market Point University before you have access to that portal. So takes you less than 10 minutes to do it with your clients, and you can do it within 30 days of the enrollment. So we used to have, I think, a limit or a max day of 5 or maybe 7 days after you enroll. Now we've extended that to 30 days. So if you can't do it at the point of sale, you can call them back within 30 days and complete that member care assessment with them. It's a nice retention tool, guys. So if you think about, these health risk assessments or these MCAs, regardless of the carrier, it does help build rapport with your client and retention with your clients, because it helps carriers like Humana identify members in a much more efficient manner that qualify for certain services and programs we offer, such as, Humana Home or counseling services, or assisting folks who have chronic illnesses or limited family support. So it definitely helps us identify those members and make outreaches to them sooner than later. John, I feel like I talked fast. I had to slow myself down there for a minute, but I wanted to see if we had any questions pop up. Hopefully that was some information that each and every one of you can walk away with. I like to call it Monday morning relevance, something you can use today if you had an appointment to talk about Humana.
From what we see in the system, Gabe, you've done a very thorough job. I would like to remind everyone who listens to today's presentation that Gabe is a great source of information for you. And one of the things that makes differences in healthcare programs that have a managed care chassis is what's the network. And I think part of that is some of the things that Humana has addressed in their systems, and you can get specific information through your agent manager with Humana as well. One of the things that we recorded in the past, Gabe, was the 3, 30, 60, 90-day procedure piece. And I think that's a great tool that you guys offer. Could you give me just a brief synopsis on that?
Yeah, so in terms of, I like to call them the 3 magical R's: referrals, rapport, and retention, right? I think that probably resonates in pretty much any sales job we have, but especially in the Medicare space, more so than ever before. So the 3, 30, 60, 90-day calls are calls that we encourage agents to get in the habit of doing. Because agents that do these calls, you're calling your agent so you're calling your client 3 days after you enroll them, you're calling your client 30 days after you enroll them, and so on, right? And you're reviewing and making sure that they're taking advantage of all the extra benefits that Humana offers in their plan. One of the more popular trainings that we do is retain and grow your Humana book of business. And we literally walk agents through all the extra benefits built into our Medicare Advantage plans. Because what happens? Most of the time, when you walk away from that sale, when you walk away from your member, what are they remembering? They're remembering what the premium is. They remember what their copay was to see their provider, right? They remember if that one drug was covered. But sometimes they don't remember, or or don't know how to take advantage of all the extra benefits built in their plan, such as a simple one is Silver Sneakers. Another one is Lifeline, who to call to have Lifeline come out and install that feature, that personal emergency response system, right? So lots of other features that we go over. So I encourage you, if you see that Retain and Grow webinar, make sure you take it, because we send all the agents who attend that all the flyers that you can share with your clients. And these are great conversations to have at 3, at 30, at 60, and 90 days. So anyway, it's just a quick overview of what that is all about and how that model works.
Perfect. I think it's a great point to make people aware of the fact that it's not just what we sell, it's what we keep. And we want to make certain that we have consistency year over year. So that said,
Absolutely.
I'm going to swipe control back, and we'll finish up very quickly with some different pieces of information about why someone wants to work with Humana through Premier. And thank you, Gabe, for your presentation. One of the things I want to make people aware of course, is the breadth of the portfolio that Humana offers gives us opportunities to bring up other discussions that pertain to what Medicare doesn't cover. And in order to take care of some of those circumstances, like perhaps long or short-term care programs, life insurance, final expense type of programs, different things that a lot of folks assume Medicare covers and doesn't. This program allows you to create an agent profile and contract with multiple carriers quickly to help satisfy those leads. And in doing so, you're cementing the business with your primary entree into the house as well. So the more product you have in the house, the better your persistency. And this is a great way to make it as simple as possible to do. We do also offer discounted E&O for qualified agents. What makes you a qualified agent? Well, that is you have a contract with us. But this is a program you own, so it's not like being added to a blanket E&O policy for one program or another. This takes care of this requirement that most insurance companies have now across the board. So we want to make certain that we can take care of you that way. I mean, Premier is huge. We don't offer everything everywhere. We want to make certain that we're able to help you cover yourself as well. So that's a great offering for you, as is the discounted continuing education programs we have through our association with WebCE. We want to make certain that your license stays in play as well. You do have an opportunity to add to your own benefit package through a modified guarantee issued disability income program for yourself, on which you're paid a commission. And much as where today's presentation is being recorded, past presentations have been as well. I alluded to the 3, 30, 60, 90-day presentation. That is available on our website and on our YouTube channel, as are different programs to help you market effectively in the community. With here's a program to approach physicians or providers. Here's a program to approach faith-based organizations. Here's detail on the offerings available to veterans in different programs. So you have a ton of material that's available to you there 24/7, and we want to make certain that we help you in any fashion possible, and that includes access to reference material 24/7. One of the programs that we really like to talk a lot about, because we feel that there's great value in it, is the access of agents contracted with our organization to Medicare Center. And it's an electronic tool that has multiple quoting engines. It enables you to create a compliant conversation by collecting the scope of appointments and recording the calls for that 10-year period for both of those through different means to make certain that you stay where you need to be in the eyes of the regulatory commissions that oversee a bunch of what we do. But it also then gives us the opportunity to do side-by-side plan comparisons with our prospects and clients. And because the program also has a contact management system, a CRM in there, it makes it simple to do your year-over-year reviews with your clients and with prospects that you talked to in the past, they'll have access to, but maybe didn't sell. That Pearl, that is a personal URL, a microsite that's available without cost to agents within our organizations, and it gives you a way to establish a presence on the World Wide Web but it's also a means that if you have your own website or you do communications through electronic means, emails, you can create that link, kick it out there, and it enables the folks that you're visiting with to shop with you on programs that you offer through this microsite. Kind of skipped over a little bit of a piece on that contact management system, but one of the things that is really valuable there are switcher tags. What are those? Well, those are identifying markings that tells you that this person may be one of the folks that are most susceptible to a change. And it gives you an opportunity then to pay special attention to them and to prioritize your calls in your contact. Lead Center, we're going to talk about in just a little bit, but the program also has within it Learning Center resources. We talk about the ability or the need to visit with people and do so compliantly and effectively. You can have a whole bunch of people raise their hands. If you can't sell them, you got a challenge, obviously. But the resources that are available in the Learning Center help improve that skill set as well. So it decreases, in a manner of speaking, the number of leads you have to have in order to reach your sales goals. So something to seriously consider in that circumstance. The program is available on a mobile chassis, so you can put it on your smartphone or your smart device. And in the words of one of those quasi celebrities on television, it's available free to agents contracted with our organization. While Medicare Advantage and PDP programs have max comps set by the government, some of the other programs that I referenced earlier, those ancillary programs that give you an opportunity to sell other product, well, many of those have incentives that come as part of those offerings. They may help you qualify for carrier trips. They may also help you qualify for premier incentive programs, the marketing support that comes into play, but also the return of our producers convention that had been on hiatus for the last couple, 2-3 years because of the pandemic. A great opportunity in this circumstance to visit the Riviera Maya, which I understand is gorgeous. A great way to make certain that you're able to fully receive your compensation from the hard work that you do day in and day out within the pursuit of your business. We also want to make certain that we put you in front of different folks on a compliant basis. There are certain programs out there that allow you to still cold call. Difficult in many circumstances now because, well, hey, you know how it works, but it is still an effective means of reaching a target population. You can only do it for certain things, but as someone who gets about 15 to 20 of these calls a day, one of the things that would be interesting is someone doing it a little bit differently, calling with a dental program, perhaps. It's a great way to fill your funnel on T65s because, hey, most of the dental programs, you see a price increase at the age of 65. So you've got a perceived urgency that comes with it as well. I mentioned as we record different presentations, those are available to you, but that includes information on community-based programs, how you maximize the value of your retail marketing experience that you have with a carrier, with Walmart, how to approach faith-based organizations and provider community as well, and be effective in that space. Different pieces of information available to you to access those programs. Many carriers will generate certain prospects for you. You see this mostly in the Medicare Advantage or PDP space. That is a quid pro quo situation. They're back, they'll scratch yours. It gives you an opportunity to take advantage of the marketing budgets that these large insurance companies have to help you speak to people interested in your services. We do have an internet lead program, a direct mail support program, that lead center that I'm going to visit with about in just a moment, and a T65 plus referral programs. I think that can be very useful for you. The direct mail is a deeply discounted program based on production that enables you to do things consistently with direct mail. And that's the secret with direct mail. If you do it just once in a while, well, you might see a lead or two or some pop, but you see then, oh, wow, there's an expense associated with that. Sure there is. It's an investment in yourself, but you can qualify for these programs in two ways, through health programs and through final expense. We work through preferred lead vendors. We vet their systems and the correspondence they send out to make certain that they stand up to the standards that you need to have them have in order to maximize the value of your direct mail expenditures. We also give you an opportunity to access direct mail that has come back and never been touched without organizing the entire campaign. So this is a great way to fill in calendars and look at things based on areas, perhaps, whatever you need to do in order to fill your calendar. Keep in mind these prices do vary from area to area and from time of year. It's supply and demand, plain and simple. But it's a very economical way of filling a calendar and making certain that you are constantly in action, doing what you need to do to help the population we serve. Got a couple of different internet lead programs here. This one is a program that is targeting both final expense and Medicare as well. And so there are different things that can come into play there that give you kind of an immediate response. Social media marketing is a big deal for a lot of people right now. You get some pretty quick results, microwave results, but those folks also, well, they expect you to get back to them very quickly as well. So something to consider when you work this avenue of drumming up business. Lead Center. Now, this is a program within Medicare Center that enables you to turn on and off lead flow based on different parameters that you set for yourself, the budget that you come into play, the area that which you choose to market, the means by which you want to receive those leads. You can have live transfers, or you can have the detail in the CRM solely. So different ways of pursuing business in that fashion. So it's a great way for you to access fresh leads and do so in a system that gives you a means of follow-up. So getting a lead is incredibly important. Making certain we can contact that and consummate that relationship is an even greater opportunity, and the system allows you to track that and do so more efficiently. That T65 locator, well, that's a program that's available to you where you download it to a smartphone or whatever device you happen to be using. They verify that you have a contract with us. It's then made available to you free, and you can set parameters and find out where some of this targeted audience lives. And that can make a big difference if you're stacking appointments in an area and one cancels. Well, gee, who can I visit that's in this area for what product? I'd be careful about door knocking, but you can do that for final expense. You can do that for dental. You even do it for med sup. You do it correctly. So some of the things we want to make certain that you do is have available to you all the resources to make certain that your schedule stays as plump as possible. That referral program, it goes beyond making certain that we remember to ask people that we're dealing with in the sales process, whether they buy or not, for help with other people that may be in need of our services. But it's also a great way to go back to our book of business and keep them in the flow. Hey, Mr. Client, I appreciate the confidence you have in me and in working together on our health insurance programs. I have a program newly available to me in that great dental coverage. Do you know of people that could be in need of these programs? One of the things they're going to do right away is, well, gee, I don't have enough dental coverage myself. What about me? So it's a great way to not only create additional leads, but cement that book of business one more time. We do all this because we want your business. We want to make certain that we're able to deliver a full portfolio of products with full support, hand in hand with key carriers and the big boys in the market. Particularly if you're working in Texas, Humana is one of two carriers that is in every county, every one of those 254 counties in the great sovereign state of Texas. So it gives you that opportunity to have a strong partner in your portfolio, no matter where you are in the state. It's also an opportunity for you to look at the different marketing programs that Humana offers. When you have your contract in place and you're certified, it's a great way to go in there and learn more about how you market to veterans, how you can market to your book of business to both cement that coverage and to market through your book of business. Different things that can come into play really, really quickly, really fairly easily, and doesn't cause a great delay. Here we are at the time of this recording, more than halfway through the month of February. Well, this has a quick turnaround time on it. You contracted with with the Medicare programs that Humana offers. There's some really cool programs we can get underway with for you. If you're not, we can make certain that we expedite that as much as possible. So all that said and done, I want to check really quickly to make certain that we have covered any questions. And it appears that we have. So at this point in time, hey, if you're an agent that's done business with Premier and you're listening to today's presentation, I want to thank you for that relationship. I want to thank you for the business that we have together. It's our hope that we can deepen that relationship and become of even greater value to each other moving forward. For folks that are just investigating us, thank you. We appreciate you looking into the opportunities that we may share, and we look forward to the discussions of putting those in play as well. But overall, we want to thank everybody who's watched today's presentation, because it's taking a portion of your most valuable resource, and that's your time. You're investing that with us, and I thank you for doing so at this time. So until we are able to visit with you again in the very near future, we're going to wish you good selling. Thanks so very much. We'll talk to you soon.